Hello and welcome to the City of Carson's webinar related to the COVID vaccine. It's an opportunity for us to provide really good information from a prominent doctor here in the LA area. Let me be very brief in our introductory remarks. I did want to say that this is being brought to our residents and the region by the City Council of Carson. That includes Mayor Lula Davis Holmes, Mayor Pro Tem Jim Deere, Council Member for District 1, Jawan Hilton, and Council Member from District 3, Cedric Hicks. And with that, I'm going to immediately turn to Mayor Lula Davis Holmes to make some very brief remarks. I did want to say that Mayor has been on the council since 2007, and she is the first female Black elected mayor for the city of Carson when she won her election in November 2020. And with that, Mayor, I'm going to turn to you and then I'll briefly introduce Council Member Hilton after you say some remarks.
Thank you very much. And I'd like to welcome everyone to this vaccination webinar. Information is powerful and we wanted you to be equipped with the right information before we open up our vaccination site on Monday the 15th at Dignity Health Sports Complex. So sit back and ask the questions that you like. We have a very educated UCLA doctor here, and I'd just like to welcome her and thank her for her time. And with that, I am short, brief, and to the point.
And then I would like to very briefly introduce our Council Member Jawan Hilton, who is an educator, a pastor, and a bishop. He was elected to the council in 2015. And so with that, Council Member Hilton, I'm going to turn to you to make some brief remarks.
Thank you very much. One of the reasons why I think this town hall is so important about a vaccination, African Americans at the rate of 7.5% in our community who is eligible for the vaccination have only been vaccinated. So it is our hope that you will find information that will be great and useful. What I'm seeing is in our communities, our Black and brown are not getting vaccinated, and there are people coming from other areas, Malibu, all these other areas to get vaccinated in our community. So please make sure that you get the information and make the decision to be vaccinated. Thank you.
And then with that, let me turn to introducing Dr. Evelyn Curls, who is here. I really want to thank you also for participating in this. Thank you so much. Dr. Curls grew up in the LA area and attended Harvard Westlake High School before going on to receive her BS in biomedical engineering from the University of Southern California. She obtained her doctorate in medicine while receiving her master's of business administration at UCLA. Before starting her residency training, she worked as a consultant for Johnson & Johnson, both domestically and abroad. Being part of multiple UCLA programs, Dr. Curls has been able to receive increased exposure to fields, all kinds of fields, including sports medicine, podiatry, dermatology, East-West medicine, as well as primary care of the mentally complex patient. She's trained in primary care, including preventative health care, women's health, family planning, primary health of patients with HIV, management of disease processes such as hypertension, diabetes, and hyperlipidemia, and primary care of patients with solid organ transplants. Dr. Curls also holds in administrative roles and serves as the Vice President of the Department of Medicine Practice Group, which is an elected role in which she serves as the executive board member that is tasked with creating and implementing policies across the Department of Medicine. I'm going to stop there. There's so much more to her background. But with that, I want to turn this over right now to Dr. Curls to make her presentation, and then we'll come back with some questions that we received from those registering and some additional Q&A after that. So Dr. Curls, please go ahead.
Thank you all for inviting me and for having me today. It's a privilege and a pleasure to be able to speak with you all. Let me know if you can't hear me, I can speak up. So we'll start off. So next slide. All right, so what is the best response to a pandemic? How do we get out of all of that? Of course, we want to be wearing our masks, socially distancing. But the reason why I'm here is to talk to you about vaccinations and how vaccination can help us get out of the pandemic and how it's the best response we have to a process like this. So vaccines protect the individual person. It doesn't protect the whole group unless a lot of people get vaccinated. And with that herd immunity and with that protection, we're able to protect the people who are unable to get vaccinated. In order to understand how the vaccine works, we need to first understand how our body fights off infections in the first place. Our body fights infections by using our immune system. And our immune system recognizes germs, bacteria, viruses, and creates antibodies to those viruses and to those bacteria. And that is what helps us fight off infections. It's the antibodies, the memory of our body against those infections that help us mount a response to make sure that we can fight it off appropriately. And vaccines help by stimulating the immune system to make antibodies. It's how we train the immune system to recognize when a virus is entered and then attack it. Next slide. How were the COVID vaccines created? So they were created the same way that every other vaccine was created in the different phases. Phase 1 is usually very healthy young people, usually around the age of 25, and it's 20 to 100 healthy volunteers that we use to make sure the vaccine is safe, to see what doses are effective, to make sure there's no real side effects. That's phase 1 of every vaccine trial, as well as for the COVID-19 vaccine. Phase 2 is where we recruit several hundred volunteers. And this is where we can see what the short-term side effects are because we have a larger number of people and how the volunteer's immune system responds to that vaccine, the dose that we figured out in phase 1. And phase 3 is where hundreds or thousands or hundreds of thousands of people are recruited to make sure it's safe, make sure it's effective, and to see how many side effects occur when we look at a large population. Next slide. Was the vaccine made too quickly? So this is a question that everyone is concerned about because usually vaccines have a timeline of 5 years at least before they're made. And this was made what feels like overnight because we just had this pandemic breakout and now we have a vaccine already. So the reason why this vaccine came out a lot faster than the other ones was because of collaboration. Different companies are incentivized for previous vaccines and for medication to compete, because it's the company that comes up with the first idea is the one that's going to make all the money. So no one shares information, no one is giving out the secrets of how they made their vaccine work to anybody else. However, in this case, countries all around the world incentivize the opposite behavior. They incentivize companies to work together. So great scientific minds from all over the world were sharing information instead of hiding it. So we were able to get to a cure, a vaccination a lot faster. The other thing is that the paperwork and the red tape was cut out. There are careers of people who just do paperwork for clinical trials. That's all they do all the time because there's so much. In these clinical trials, for this vaccination, the paperwork part was cut out. So there's no one writing 3 months of paperwork and then waiting 3 months for a board to review it. Those kind of red tape things were taken away. So if the collaboration of everyone coming together and the cutout of all the red tape that's unnecessary and has nothing to do with the safety of the vaccine can be taken away, we can get a vaccine a lot quicker. And this is what happened with this vaccine. Next slide. Was the US government involved? The only thing they provided for this was the coin, really. It wasn't about making sure that they got, what they wanted or have scientists on board who are working for the government. It's not that. They, like every other government, helped to incentivize scientists to come up with the best vaccine that they could. There was no influence by the American government or any other government in that case to make the vaccine. Next slide. General questions. There's 2 vaccines that are currently authorized for emergency use, Pfizer vaccine and Moderna. Both are very effective, as we'll see on the next slide. They both come in 2 doses. Pfizer vaccine, you get 21 days from the first one, and the Moderna, you get 28 days after the first one. Both are given as an injection to the deltoid, and you have to have the same vaccine for both doses. So that's also what makes it a little bit more logistically challenging because you can't have gotten the Pfizer vaccine, the first vaccine, and then get the Moderna the second. It has to be the same vaccine. 2 Modernas, 2 Pfizers, you can't mix them. Next slide. But both are extremely effective, 95% effective. These are effectivity rates we've never really seen before. To give you some context, the flu vaccine is about 30 to 40%, 48% effective every year. The highest effective rate was 2016, and that was 48% effective. So this blows those types of vaccines out of the water. 95% is something that we really have not seen in the past for an infectious disease like this. And so when people are concerned about, well, I get the flu vaccine and then I get the flu still, well, that's because it's 48% effective. For things that are 95% effective, we don't expect you to contract and have COVID symptomatically the way that you would with the flu because it's not as effective. This one is way more effective. Next slide. How does the vaccine work? The easiest way to think about it is thinking that the mRNA vaccine is like an instruction manual. It's an instruction manual that's inserted into your body. Your body sees this manual, and the manual tells your body to make proteins that look exactly like the proteins outside of the COVID vaccine, the COVID virus. So your body sees these proteins that look very much like the proteins on COVID, and your body attacks those proteins. And it makes antibodies to those proteins. It makes a memory of what those proteins look like. So when your body actually sees COVID-19, it will attack it because it looks just like the proteins that they saw before. After that instruction booklet, the vaccine is used to make those proteins, your body actually breaks down that vaccine and it's taken out of your body. And your body breaks down the proteins that they made in response to the instruction manual. So the only thing left of the vaccine is your body's memory of what the proteins look like. And those are the antibodies. So the vaccine is not a live virus. It's not a dead virus. It's not any portion of the virus at all. It's just that instruction manual. That's what mRNA is. It tells your body to make proteins that look like COVID. So when your body actually sees COVID, it will attack it. Next slide. Should I be worried about mRNA? It's a new technology that we use for vaccines, but it's not something that the scientific community is not aware of or doesn't know about. We've been using mRNA for many years. It's the first time it's been used for a vaccine, but it's not a technology that the scientific community is not comfortable with. Next slide. What's in it? So it's just that mRNA molecule. It's just that line of mRNA that tells your body to make the proteins. It's not a live virus. Sometimes we give children live viruses of flu vaccine or MMR or shingles vaccine. Those are all live viruses that have part of the virus inside. That's not what the COVID-19 vaccine is. There's no portion of the virus there at all. It can't give you COVID-19 because it's not the actual virus. It can affect your DNA because it doesn't go inside of your cell. It's just this instruction manual that's out in your body that your body will see, process, make a protein for, and that's it. It's not going into your DNA. It's not affecting any cells in your body, and your body breaks down the mRNA as soon as it uses it to translate. It doesn't contain eggs or mercury or other preservatives like other vaccines do, so it shouldn't cause an allergic response like some of the other vaccines do. Besides that mRNA molecule, there's also lipids and salts, and I'm going to list those in the next slide. These are a list of the lipids, which are just fats, salts, and sugars that are included in the vaccine. For some people who've had reactions to vaccines in the past, these are the things that we're concerned about. It's not the actual mRNA, it's these salts and fats that some people are allergic to. And if you have been allergic or had anaphylaxis to a flu vaccine in the past, you would want to compare these ingredients to make sure that they don't overlap so that you would know that you weren't allergic to the COVID-19 vaccine. And you can find these ingredients on the CDC website. Next slide. Is the COVID-19 vaccine safe? So yes, it's been approved for emergency use, and there's been 152 million vaccines given across the world. And as far as safety is concerned, depending on Pfizer or Moderna, looking at the two, the incidence of anaphylaxis, which is a very bad reaction in which you have wheezing and swelling and need to be hospitalized is about 2 in 6 compared to Pfizer and Moderna out of a million. So every 2 out of a million vaccines, every 6 out of a million have a very large reaction. Compare that to things like the flu vaccine and the other vaccines we take, where it's more like 12 to 25 out of a million. So the safety of this is much, much safer. And it's safe for everyone. So there's a lot of healthy mistrust among minority communities of the healthcare system. And we have reason to be distrustful. There have been many egregious things that have happened in the past, and we rightfully have grievances with the healthcare system. We want to make sure that the vaccine that they're making for the general population is good for everyone. One thing we know is that everyone, every type of person was included in the clinical trials, where African Americans make about 13% of the American population. They're about 9.8% represented in the clinical trials. So we know that they were tested out on African Americans and it was proven to be safe for them. Same thing for the Latina community. They make up about 27% of the US population, and they were represented about 20% in the clinical trials. So we know that it's safe for all races, not just what we would think is the general white population. It's been tested on everyone. Next slide. What are the side effects? So side effects are different than allergic reactions. So some people will say, well, I had an allergic reaction to the flu vaccine, so I don't want the COVID-19 vaccine. An allergic reaction is what I was talking about before, those 2 in a million. It's when you get really sick, when you need to go to the hospital, when you have wheezing and swelling and you can't breathe, you have a large rash. Those are allergic reactions. Side effects are different. Side effects are what the vaccine most likely will produce if your immune system is responding to the vaccine. So some of those side effects include pain at the injection site, fatigue, headache, muscle aches, joint pain, mild fever. It's not a sign that you have COVID. It's a sign that your body is responding to the vaccine. So like I said before, your body gets this vaccination. It's an instruction manual. Your body then starts to make these proteins that look like COVID, and your body attacks those proteins. Anytime your body attacks a foreign object, then you're going to have an immune response. Just like if you were to get cut and you had some dirt come in your arm, you're going to have swelling. It's not necessarily the dirt that's causing the swelling, it's your body's immune response to that. So all your white blood cells rush to that area and try to attack and take care of the thing that's causing you issues. So it's the same thing for the vaccination. When you get vaccinated and your body sees this protein that's made, it attacks it. And when it's attacking, you're going to feel the side effects of your body and your immune system working. And sometimes that can look like fever and joint pain and headache, but these usually go away pretty quickly, usually in a day or two. Yes, they are more pronounced after the second dose, but that's because your body is really attacking it. It's seen it before, and it's mounting a larger attack against those foreign proteins that the vaccine has made. There's a very, very low chance of an actual allergic reaction. Like I said, it's 2 in 1 million, 6 in 1 million for the vaccines. Anyone who has a very serious allergic reaction, like an anaphylactic reaction to a flu vaccine or any other vaccines, should talk to their doctor. It doesn't mean you can't have the vaccine, but we do need to go through, look at the ingredients, see where they overlap, so we can know whether or not this will be safe for you. But again, allergic reactions are not the same as side effects. Next slide. What about the Johnson & Johnson vaccine? So this is a 1-dose vaccine, which is different than the ones that we currently have. And it was found to be 72% effective in the US, which is not the 95% of the Pfizer and Moderna, but at the same time, we have something called a cushion effect, and I'll try to explain it. So yes, it's not 95% effective, but remember the flu vaccine was only about 48% effective in a really good year. So say the virus needs to have like 300 different replications or 300 viral count in order for us to be sick and for us to infect others. So we get COVID and it has to get up to that 300 threshold of viral products to make us sick and make us infect others. While the Pfizer and Moderna vaccine might push down, once we get it, might push down that viral load to like 50, and we don't get sick and we don't pass it on to others. The Johnson & Johnson vaccine might only push that viral load down to 150. But at the same time, it's lower than the threshold of that 300 that we need to get sick and to infect others. So while it's not as effective, it doesn't go all the way down to 50, it might only go on up to 150. It still is effective because it's below the threshold that would make us sick and make it able for us to give it to other people. So a lot of people will see this and say, well, I don't want to take it because it's a lot less effective. It's still effective enough to make it not sick and not transmit it. So that's what we're looking for, that key piece of not making us get sick and make it a lot harder for us to transmit it to other people. What about this vaccine is different? So it's a viral vector technology, which means it actually just implants those proteins right away without having to be translated from mRNA into your system. Your body will see those proteins, attack it, and it will remember what the proteins look like. So it's a different step than the mRNA vaccine in the sense that you have to have an instruction menu that translates into a protein. These use kind of a viral vector and deliver the protein right away. Your body, but it works the same in the sense that your body will see the proteins, remember what they look like when you actually see COVID, and attack the proteins that are present. Next slide. How long will I have immunity after the vaccination? We don't know. Ideally, we would watch people for many years after vaccination and see when their immunity wanes. We haven't had many years to follow people, so we don't know. What we do know currently is that vaccination for and immunity for the people who have already been vaccinated and being followed in the clinical trials have not waned yet. And that is a really good thing to know because we do know that natural immunity will wane after around 3 months on average. But following the people who are clinical trials and have been followed for months, the immunity is still strong. So we know that it lasts longer than natural immunity, but we don't know how long it will last. Next slide. Can I catch and transmit COVID-19 after I'm vaccinated? So the answer for this is a little bit complicated. We haven't had studies to look specifically at transmission. What the studies look at are hospitalization and death. And we know that the vaccination will stop you from getting hospitalized, stop you from getting sick, and that's the goal. We don't want people getting sick and dying from this disease. So we'll stop that. Will it stop you from transmitting it? We don't know fully if that will be the case. There are recent studies that do suggest that yes, if you get vaccinated and you catch COVID, you're not going to have a viral load high enough to transmit it to other people. We can't say with 100% certainty that that's the case. But at the same time, there have been new recommendations coming out from the CDC currently that say that after you're vaccinated, you don't have to worry about quarantining like you would if you were not vaccinated, which suggests that the transmission rates are much, much lower if you are vaccinated. Next slide. Who should get the vaccine? So if you're asking me, it's probably going to be everyone. There's very few people who the answer is no, should I not get the vaccine? For most people, the answer is absolutely yes. You should not get the vaccine only if you had a severe allergic reaction to a previous dose, or if you've had a severe allergic reaction to an ingredient in the vaccine. And you would know that because you've had an allergic reaction to something like the flu vaccine before. These people in this category on the other side are not precluded from getting the vaccination. You just need to talk to your healthcare provider about it before you do. People who are breastfeeding, people who are pregnant, all of them can get the vaccine. You just have to talk about the timing with your medical professional. If you're immunosuppressed on chemo, all those things are still okay. You just have to coordinate a little bit more. As far as whether or not you have a fever, if you currently have active COVID, you should not get the vaccine. You should wait, but it doesn't stop you from getting it in the future. Next slide. Should I still be vaccinated if I had COVID? Yes, you absolutely should. As I mentioned before, we know that natural immunity will wane after a certain period of time, and we think that period of time is around 3 months, which means we've seen multiple reinfections in people already. This has been around almost a year, and people who got it in March of last year can have gotten it again in October and gotten it again. So natural immunity does wane, and vaccination immunity lasts longer. So it's really important to, yes, be vaccinated even if you've already had COVID-19. Next slide. It's better to get vaccinated than contract it naturally, one, because of the length of time of immunity, but also because contracting the virus can have long-term effects, even for people who are asymptomatic. We can find that if you look at their lungs months later, you can see that there's still effect of coronavirus that's still there. And we want to avoid any long-term effects that could happen from that. There's cellular damage that happens, even for people who have very mild disease, that we would love to avoid. And one way to avoid that is to get vaccinated instead of getting it naturally. So why get the vaccine if most don't die from COVID-19? Yes, it's true that a lot of people get COVID and survive, but as I mentioned, it can have very long-term effects that will affect your quality of life. And it really depends on what population you're talking about. African American, Latino people have 3 times the death rate of their white cohorts for when they contract COVID-19. So yes, not everyone dies from COVID, but the long-term effects can be devastating, and you want to decrease your risk of death from any disease. So vaccination is very, very important. Will the vaccine still work given the new variants? Yes. So we think that they will be effective. Pfizer and Moderna appear to be effective against the variant in the UK, and they're a little bit less protective against the South African variant. But at the same time, they still have that cushion effect that I was explaining before. So while it's not 95% effective, it could be in the 60-70 range, which is still much better than any vaccine we've had in the past, and will still provide some level of protection so we can know that we won't get very sick from it. Next slide. Vaccines are not expected to be offered to children under 12 for a very long time. For Moderna, you can start to vaccinate at age 18, for Pfizer at 16. There's currently trials that are underway for kids 12 to 17. But as you can imagine, recruiting children for these vaccination trials have been proved to be difficult. There's not a lot of parents out there offering up their children to go into the clinical trials. And there aren't any clinical trials that are currently underway for children under the age of 12. Which is another reason why we all need to be vaccinated to help protect them. They can't get vaccinated, and herd immunity is going to be important so that we can, as a group, protect the people who are unable to get vaccinated. Distribution. Who will receive the vaccine first? So most states and counties are bound by the supply that we have, and who the people who dictate who we can give it to are the people who provide the supply. So the state of California and LA County have kind of strict rules around who should be getting the vaccine at this time, and I can show you the slide of that next. Healthcare workers were the first rollout. The majority of healthcare workers have received at least their first dose, if not their second dose already, and we've now moved on to age 65 and older. Right now, that's the majority of the people who are getting the vaccinations are those age 65 and over. And in some different health systems, it's not a come once. It's really just looking at the risk profile of those people over 65, and they invite people who are the sickest of that group first. And in some institutions, it's anyone over 65 who can get vaccinated. Next in line will be workers in essential and critical industries, workers who are have a lot of community interface. So police officers and firefighters and people who have essential jobs like working in a grocery store, bus drivers, teachers, things like that. Critical industries that have a lot of community interface will be next after that. And then after that, it'll be people age 50 to 64, and then younger people who have underlying conditions that will make them more vulnerable should they catch COVID-19. And then the last is everyone else. Next slide. It's unlikely that anyone will be able to choose which vaccine they get. It's really about supply and making sure that you get the right second dose. So like I said, you can't mix doses. You can't have a Pfizer, you can't have a Moderna. So when we allocate doses, it's really assigned to that group of people, and you can't choose which one you get because we don't know if we'll have a supply for the second dose for you. So it's really important to just get whatever dose and whatever vaccine is available because we can't pick and choose when we'll have the supply of the other one. When we give you one, we save the second one for you. Next slide. Will the COVID vaccine be mandatory? It's unlikely. There are not any vaccines that are mandatory currently, even for healthcare workers, really. So I don't know that the COVID-19 vaccine will be mandatory for anyone. It's not a requirement to fly currently or to work in the healthcare field. So if it's not a requirement for healthcare workers, I doubt that it will be a requirement for anyone else. Just like getting the flu shot is not mandatory, COVID-19 vaccine is not mandatory. What does life after vaccination look like? It still looks like a mask and social distancing until a lot of people are vaccinated. They're not 100% effective. So some people will, that 5% will still get sick. And because of that, we need to make sure we wear a mask. And also people who are immunosuppressed, like I said before, it might decrease our viral load to very low. But for people who are on chemo or people who have AIDS or people who have cancer or elderly population whose immune system is really low, we don't know if that small viral load that's left after we get vaccinated can still infect them. So in order to protect those people, we need to be wearing a mask and making sure we stay 6 feet apart. Next slide. Will I need to quarantine after vaccinations? Updated recommendations say that no, if you're fully vaccinated and you've been fully vaccinated for at least 2 weeks, you will no longer have to quarantine after a possible exposure. You still want to watch out and make sure you're looking for any signs or symptoms. But as far as the 10-day or 14-day quarantine that was required before or after exposure, if you're vaccinated, you do not have to do that any longer. Next slide. Should I wear 2 masks or 1? Also new recommendations. So masks need to be worn properly. And it's a little bit harder to wear 1 mask properly because there can be gaps on the side. There can be gaps around the nose. Anyone who wears glasses and wears their mask knows that there's fogging up of your glasses when you're wearing a mask. And that air vapor means that air vapor can come out and air vapor can come in. And in order to make sure that we wear our mask properly, having a second cloth mask over your surgical mask will help it fit and kind of form a seal in the way that it should around your mouth and around your nose. If you don't want to wear 2 masks, you just make sure you have to wear 1 that fits very well, and that's at least 2 layers. So what we call 2-ply or 3-ply surgical masks are important to wear. If you want to wear N95, that's really only necessary for the healthcare setting. But any type of 1 mask should be definitely at least 2-ply. And face shields alone are not a substitute for a mask. So if you watch, reality TV, people will be on there with their face shield, no mask, talking like that's okay. That doesn't work. So you have to wear a mask. A shield is just not enough. Next slide. So can the vaccine cause autoimmune problems? The answer is no. It doesn't go into your cell, it doesn't affect your DNA. So the immune response is not affected in anyone who has autoimmune disease by this vaccination. Next slide. It can cause infertility or sterility because it doesn't affect your DNA. It doesn't enter any cell. So there was a lot of confusion and concern about whether or not the COVID-19 vaccine can affect any sexual organs, and the answer is no. If you have a weak immune system, these are the people we want to get vaccinated. So some people have to hold their chemotherapy for a week or 2 before their vaccination, or hold the medication that affects the immune system for a couple weeks after it, just to make sure your immune system has a chance to respond. But even if you have a weak immune system artificially, because we're giving you medication to weaken it, or because you have an underlying condition that makes your immune system weak, you are the exact people we want to get vaccinated so that you can have some protection against the virus. So yes, most cases, you can still get vaccinated even if you have a weak immune system. And can I get vaccinated if I'm pregnant or plan to conceive? Absolutely, you can. You just have to talk to your OB about timing. But remember, healthcare workers were the first to get vaccinated, and the majority of healthcare workers are women. 75% of nurses and physicians, MAs, medical assistants, caregivers, they're women. So, and they're childbearing age. So all of those healthcare workers, there were tens of thousands of women who were pregnant or plan to conceive who have gotten the vaccination. It's proven to be safe. Next slide. If you're breastfeeding, yes, you can also get the vaccination. And those antibodies that are present will be passed on to baby as well, providing some level of protection. Can I wait? So yes, you can wait, but it's really important to get vaccinated as soon as possible. If you're worried about variants, COVID-19 can only mutate if it replicates. One way to stop more mutations from happening is to stop the replication. And the way we stop replication is stopping people from getting infected in the first place. The longer you wait, the longer the chance of getting infected, the longer the virus will mutate, the higher the chance of mutation. So it's really important to get vaccinated as soon as you get that invite so that you can stop the chain of mutation, stop the chain of infection. So as soon as you get the invite, it's best to vaccinate it then instead of waiting. Next slide. And these are just some additional information and resources you can get for FAQs and for guidelines around vaccination. I think that's it.
Yep, that's the last one.
Thank you.
Okay, so with that, I would like to ask you, Doctor, a few more questions. I know that you've addressed some of these things, but these were the questions that when we asked people to register were foremost on their minds. So if you don't mind, you might be repeating a little bit, but let's go with this. Have people died of the vaccines and why?
So across the world in 75 countries, there's been over 152 million vaccinations. A lot of different countries have produced deaths that have been associated or in the timing with vaccination. So within a few weeks of vaccination or so. But after further review, none of them have been causally related to the vaccination. So the answer is no, there have been no deaths from the vaccination.
Okay, great. You talked a little bit about the safety of these vaccines, but I think a lot of people want to know, is one safer than the other?
No, both have been shown to be equally effective and equally safe.
Okay, thank you. How about, is one more effective? And you did talk about this. So why don't you speak a little bit more about that again? Because it's a little confusing. They all have different rates of effectiveness. So if you could address that.
Yeah, so both the Pfizer and Moderna, which are the only two that have emergency authorized use, both are 95% effective. For the Johnson & Johnson, which has not been authorized yet, it's a little bit less effective, about 72% effective.
Okay. What if I have an allergy? And I know you spoke about this, but it's a big concern for people. If I have an allergy, what should I do? I'm concerned about getting the vaccine. If I have an allergy, how would I know if it's right for me?
So we'd have to decide whether, or talk to your medical professional about whether or not you had an allergy or a side effect. So it's really an allergy to the vaccine alone. So not allergies to medications or foods, not that. It's an allergy to a prior vaccine because there are some ingredients that are shared between the vaccines. So you would want to make sure that you haven't had an allergic reaction to a prior vaccination. People who are more kind of allergic in nature, people who have a lot of seasonal allergies or food allergies or medication allergies can still get the vaccine. Some people may want to pre-medicate with Benadryl before they go, and they may not also want to let the provider know when you go get vaccinated that you have allergies in the past, and they can choose to watch you for a little bit longer than they would everyone else who comes in and gets vaccinated and watch for about 15 minutes.
You know, I want to jump in and ask you a follow-up because you said that people can pre-medicate, but could you be really specific about that? Because I've also heard people say, can I take like an ibuprofen for my arm if it's sore? And, you know, there's some information out there that might weaken the impact of the vaccine. So what medicines can be taken?
So I would not recommend taking a medication unless you've been told to or you have severe allergies in the past. But there were studies that suggest that you can't take NSAIDs. Those studies have actually not borne out to be completely true. There is a theoretical decrease in the immune response when you take an anti-inflammatory. So if you take something like ibuprofen or Aleve, because it's working to decrease your inflammatory process, if you take that before, in theory, you would take your vaccine in your inflammatory process, your immune system would not be as robust in the response. This is all theoretical and it hasn't actually been proven to be true, but some people will tell you not to take ibuprofen before that. Not the same for Tylenol and not the same for Benadryl.
Very important. Does the vaccine have a lesser effect on communities of color?
No, it doesn't have a lesser effect. It's equally effective on all communities. There's been no studies to show that it's less effective in African Americans or Latino population or Asian population.
Okay, so I have a few more questions and I want to make sure that we have time for the council to come back on with closing remarks. So I'm going to go through the questions that I have. What would you say to people who are living alone about and being concerned about what might happen to them in their homes after they take the vaccine?
So we monitor all people who have the vaccine for at least 15 minutes after their dose at the vaccination sites. As far as side effects that happen afterwards, as I mentioned before, there's been no deaths associated with the vaccine, but you can have side effects of feeling fevers, chills, things like that. You can rest assured knowing that these side effects should go away within 12 to 36 hours. But as far as anaphylaxis and things that would happen that would make you get hospitalized, those happen really close to the vaccination time. It's not something that happens when you get home.
Okay, so they should feel comfortable when they're home, and if there are any issues that they have, they should call their doctor.
Yes.
Okay, well, so it's a little confusing because some people are able to get the vaccine now based on their age or their jobs, but other people in their households are still not eligible. And I know you talked about people still needing to wear their mask. What do people do at home? What precautions do they take until the entire household has received their vaccine?
Until the entire household has received the vaccine, then it's really important to continue all the regular social distancing and masking that you've been doing before. Vaccines work best when a whole community takes them. The individual is protected, but not the household. So everyone else who's not vaccinated would still need to go about the same masking, staying 6 feet apart, making sure they're using hand sanitizer as everyone else.
The Pfizer and Moderna vaccines require 2 shots. It's a little confusing for people to understand. Is Johnson & Johnson vaccine stronger since only 1 shot is required? And maybe you could think about if somebody only takes the first shot of each of the others, how does that compare to the Johnson & Johnson 1 shot?
Right, so the Johnson & Johnson is a viral vector. So unlike the Moderna and the Pfizer that are mRNA, and they kind of require your body to read this instruction manual and make protein, Johnson & Johnson just delivers the proteins right away. Because it's only 1 shot, it's not necessarily stronger, and it's not as effective as the 2 shots. So it's about 72% effective, whereas Moderna and Pfizer are 95%. After, if you just get 1 shot of Moderna or Pfizer, about 11 days after that first shot, you'd have maybe 50% immunity, which is less than the 72% with the 1 Johnson & Johnson. Pfizer and Moderna were not designed to be a 1 shot and then you're done, because the immunity that you have is more like 50%, and that's just not enough. As we've seen from things like the flu vaccine, where it has an effectiveness of about 48%, people still get the flu. There's still flu in the community. If we want to avoid that, we need an effectivity rate that's a lot higher. So things like Johnson & Johnson, Pfizer, and Moderna, having everyone take vaccines that are that effective will decrease community spread.
That's a really helpful answer. Thank you. When somebody's had COVID, if they, we know that there are some serious consequences while they're dealing with fighting off COVID, but what could happen beyond that time period where presumably they've recovered from COVID? Are there other long-term side effects that have occurred?
Yes, so people's loss of taste and smell can stay away for many, many months, people can have something we call long haulers, or people who have long side effects from COVID. So not able to perform athletically as they would. So we see that in a lot of professional athletes who have caught COVID and still haven't gotten their strength back, or still unable to do the conditioning that they could do previously. And these are young, healthy people. So yes, you can have long-term effects both in your lungs and your heart. And yes, also brain fog and fatigue. Fatigue can be debilitating for many months. So there are long-term side effects.
And is that age related, or is that something that you're finding is occurring across different ages?
It's across all different ages.
Okay. So, I don't know how much you know about Carson, but we are a community that is largely of color. And, obviously this is something that's really important because so many of our population now have actually gotten COVID. And we're still concerned about the rest of the population. But there is a very big fear because of some of the history that's occurred of mistreatment in the area of vaccinations and testing without people really having full information about what the risks might be. Could you talk a little bit about, as an African American, who is very, very knowledgeable because of your background in medicine, what is it that you can tell our community that might make them feel more comfortable about what's going on with this vaccine specifically, and particularly people that are 65 and older?
So the thing, yes, this vaccine is safe for all races. It was tested on African Americans, tested on the Latino population. It's not something where we were excluded from or got a different type of vaccine, or were used kind of as guinea pigs in a way that other cultures weren't. From that standpoint, it's safe. My main concern is really, yes, of course, the safety of the vaccine, but it's the alternative of what can happen if we get COVID. We know that Latinos and African Americans have 3 times the death rate of their white cohort. We are sicker. We represent anywhere from 33 to 50% of the hospitalized cases of COVID-19. So it's more about what can happen if we don't take the vaccine than really worrying about the safety and efficacy of the vaccine that hasn't had anyone die from it and has an allergic reaction of 6 in a million, when we represent 50% of the hospitalized patients with COVID-19.
So the risks related to COVID are more significant than the
definitely outweigh the risks associated with the vaccine by leaps and bounds, by hundreds of times. The risk associated with the vaccine is so much less than the risk associated with actually contracting COVID.
I think you talked about this also during your presentation, but could you clarify about whether people might still be able to get COVID after receiving the vaccine?
So it doesn't stop you from getting COVID. It stops you from getting sick from COVID. It stops you from being hospitalized, from dying. We're hoping that it stops you from spreading it to other people who are vulnerable. And we have studies that suggest that it does, but it doesn't stop you from getting it. You just get it and you don't know, you feel fine. And that's what we want. That's the goal of the vaccine, is that you get it, you get the vaccine, and you might contract the virus, but you're still okay.
So you did say this also, but I think it's worth repeating. The reason that you're telling everybody that they still have to follow health protocols after the vaccine is because there's a chance that even if they are not sick from it, even if they're asymptomatic, they can spread it themselves?
Yes, especially the people who are immunocompromised. We don't know how low the level of viral load needs to be to give it to someone who's elderly or someone who's already has a immune system that's a little bit lower. So it's really important to continue to wear those masks until everyone has a vaccine, until there's a herd immunity where we're not able to kind of bounce it around amongst each other.
So we're going to put up a flyer that shows where people can, starting Monday, get a vaccine. But doctor, while people are looking at this, are there any final remarks that you want to make, to reemphasize a point that you thought might have been important that the folks listening might want to hear?
I guess the main point is trust the science. I know that there's a lot of mistrust and there's a lot of just feeling like you don't want to get it. I just don't know how it works. I don't know if it'll work for me. I'm worried about the side effects. trust the science that it's 95% effective. Trust that it'll protect you and your family from getting sick. That's the main thing. I know that, and make sure you have conversations with people who can answer your questions, because when we get down to the science of it and to kind of like taking out all the disbelief about it and understanding how it works, it's a safe vaccine and it's effective. So if you have any questions, don't just not get it because you have questions about it. Make sure you ask those questions, get those questions answered so you can become comfortable with it, because knowledge is power and knowledge will empower you to know the truth about the vaccine and how it can protect you.
Really excellent presentation. We're so appreciative. The timing couldn't be better also because we're actually fortunate to have a facility opening at our Dignity Health Center on Monday. And we want to make sure our community gets appointments. It's open for 5 days, only 5 days next week. And then after the wait period, people will be invited back for their second vaccination. Kevin, who's taking care of audio for me, would you please let the council members back on so that we can allow the mayor and council members to make any final closing remarks?
Will do.
Is the mayor on as well?
I sent her the request. Let's see if she's coming on.
There she is. And there may be some other council members joining, but in the meantime, Mayor, would you like to make some closing remarks?
Yes, first of all, Dr. Curls, thank you so much for this very educational, informative webinar. I do want to let our residents that are listening, that are attending, that I am working with Cal State Dominguez Hills. Now we want to present these monthly webinars so that we can keep our residents informed about this vaccine and how important it is to take the vaccine, because there's so much misinformation out there. And I also want to remind you that Monday, as our city manager said, thanks for the hard work that we put in, we will have a vaccination site with Dignity beginning Monday, the 15th through the 19th. And Dignity, you know, is right there, our Dignity Sports Park. But if you have trouble getting on and registering, please call 310-952-1796. And someone from the city of Carson will take your name and your information and make sure that you get registered. It's so important for our Carson residents to come out, and 65 and over, which this vaccination site is for, that you come out and get your vaccination. I hope you have enough information to make you make an informed decision, because I know a lot of people, like we said, of color are not, some are not going to take the vaccination. But after this webinar, you should have some information that will guide you in the right direction. As the doctor said, the risk of not taking the vaccination, the risks are higher if you don't take the vaccination. So please, please take the information. To my city manager, I would like to know if this webinar could be on our channel 35 and channel 99 running for those that did not get an opportunity to participate today. Thank you again, Dr. Curls. Thank you, Madam City Manager, and to all the staff for helping to put this webinar together. And again, we will be hosting monthly. It is my plan to host monthly webinars. And Dr. Curls, we may have you back again. Thank you.
Councilmember Hilton, would you like to make some remarks?
Absolutely. Thank you, Dr. Curls, for your extensive presentation. We certainly appreciate that. And I think it's coming from a true place as a person of color giving the presentation that's being backed by it. I have received my first portion of the vaccination, which was the Moderna shot. I know that some people have been skeptics of getting it, but I think it's incumbent on us to make sure we get it in our communities. Clearly, we're dying without it. It couldn't be much worse if we got it, right? Because there are a number of people who are dying. There's a number of things that you pointed out, the Moderna and the Pfizer. The creation of the Moderna vaccine, there was some people of color at the table. Can you kind of explain that? Just so people who may have this misconception of that it's another Tuskegee experiment or anything like that. Can you explain maybe like the dynamics of the panel that created the Moderna shot or anything like that?
So the lead investigator, the scientist behind it, is a female of color. And she's a Black physician and scientist who was there advocating, creating, and making sure that it was safe for our population. So this wasn't created by someone who didn't understand the complexity and intricacies of all races, especially the African American and Latino populations. This was made by us and for all.
FUBU, thank you so much. I appreciate it. That was just messing with you. Thank you. I'm going to release myself off the line because this wasn't a notice meeting. This wasn't like a notice meeting. I think this violates the Brown Act if we are here. So I'll release myself off the screen so that Mayor Pro Tem could speak, because this is clearly, it's not supposed to be. So I'm done. Thank you.
Thank you. Thank you, Council Member. Mayor Pro Tem, did you want to make a few remarks?
Well, you know, I was just here as an observer. I really appreciate all the participants bringing this forward to the people of the city of Carson. I want to thank the mayor and Councilman Hilton and my colleague Cedric Hicks, and of course Sharon Landers and all of our staff, our legal counsel, and of course Evelyn. You're very knowledgeable, and you're the kind of person that we need to listen to, because you are an expert, and there's so much disinformation out there. That's why this is a really useful and beneficial webinar. So that's my brief comments. And again, thank you, all of you, for participating. Thank you, Sharon.
You're welcome to MPT. I also want to give Councilmember Hicks, who's a council member for District 3, an opportunity to make some closing remarks.
Thank you, City Manager. To Madam Mayor, thank you for spearheading this along with our Councilman Jawan Hilton. To Dr. Evelyn Aurora, thank you so much. I was listening in on your presentation. The information was very informative. It gave good information to our residents in the city of Carson. I just would like to continue this process, and with this, in this COVID-19 era, to continue doing these types of town hall meetings to at least inform our community of different things that are addressing their needs and issues in the community. But again, to all of you, thank you for allowing this to be presented to the citizens of Carson. To Madam Mayor, the helm, thank you for putting forward this process, and we will continue to do good things here in the city of Carson. And to always, to everyone, thank you for supporting what we do here in the city of Carson. Thank you.
Mayor, back to you before we close. Is there anything else that you want to say?
No, that's it. We will continue to move forward, and thanks to all of our partners, and the fact that we have a site opening on 15th is just, who would have thought? If you don't ask for something, you'll get it. A closed mouth does not get fed, and we open our mouth and said, this is what we want in Carson. So Doc, again, thank you. And that's it. We will talk soon.
Okay, thank you everybody for joining us. Really appreciate it. And Dr. Curls, we could not have been happier with your presentation, and we will ask you back.
Thank you. It was my pleasure.
Thank you. Bye-bye.
Bye-bye.